Good day, and welcome to Your Senior Moment. I'm your host, Dr. Wayne Saltzman, Chief Medical Officer of Lahey Health Continuing Care. This show is looking at an option for end-of-life care, and very shortly I'm going to introduce David Agahigian, who's the director of the Sawtelle Family Hospice House in Reading. But before that, as always, a little housekeeping. We're very happy to know that influenza is on the decline significantly now, but there are still options or opportunities to get influenza as well as other viruses. So especially with regard to elders, whatever you can do to isolate yourself if you're not feeling well, manage your symptoms obviously with rest and hydration, and make sure you contact your doctor if there's any questions or concerns about your health. On the other hand, it's springtime and it's soon to be warming up, we hope. Regardless, exercise is always a great thing, and you've all heard me advocate for exercise, but be cautious. Make sure if you do decide to exercise to start slowly and build up your endurance, but always check with your primary provider as to what your appropriate exercise may be. Well, I'm very pleased to introduce to you all David Agahigian, who is the director of the Sawtelle Family Hospice House. And I've asked David to come and speak to us today because end-of-life care is an extremely difficult topic for all of us. And there's a movement now in healthcare called advanced care planning, where providers really try to understand patients and families' goals and wishes. And the goals and wishes and the shared decisions that come along with it are important in end-of-life care. So talking about something like a hospice house is part of that. So David, welcome to Your Senior Moment.
Thank you for having me.
I think everybody wonders, how does somebody get into a focus of end-of-life care?
Well, it was a very long journey. I mean, I was exposed to the hospice environment throughout my professional career. I've been in healthcare for 35 years, and I had an opportunity over the last 15, 20 years to be involved with an organization that specialized in hospice and participated in their fundraising activities and things of that nature. So that gave me a broad view of what that part of healthcare was all about.
So tell us a little bit about the Sawtelle Family Hospice House. What is a hospice house? How do people get to know about it? And tell me a little bit about how this specific hospice house kind of came to being.
Well, a hospice house is an environment for patients that are terminally ill, that need end-of-life care, which is delivered in a home-like residential environment. The Sawtelle Family Hospice House, which is now 15 years old, was actually spearheaded 16, 17 years ago by the former CEO of the organization that founded the house, which was Middlesex East VNA Nursing and Hospice. And she had a vision that this was a community service that was lacking in this area and frankly in the state. So with the support of the employees and the board of directors, she was able to get this off the ground in pretty much record time. Within a year or so, we secured the residence, which is located in Reading, Massachusetts. Actually, it's a historic home built in 1785, and we put together, a facility or a residence, to accommodate 10 patients at their end-of-life care in a very home-like, tranquil environment, as opposed to the institutional type feels you would normally expect in a hospital or a skilled nursing facility.
So the important question then is, Is there anything about it that's like a hospital or like a short-term rehabilitation facility where people may spend the end of their life? What is unique about the hospice house? Are there medical providers there? You know, how does it run?
It actually, the care one receives at a hospice house is at the highest level one would expect for your clinical care. The difference is it's in a home-like environment with all the other stresses taken out of the picture, such as the noise and distractions of a hospital or a skilled nursing facility. It's much more tranquil. These facilities are certainly for the patient, but they're also for the families. The families are going through this as well. So we'll never replace a person's home, but this is the next best thing to afford that patient the highest level of comfort and care one can receive. And there isn't anything that we can't deliver that you could not get at a hospital for the same level of care.
So we know that from the literature that people do prefer to die at home. What drives folks like this in families to still want to be in this type of environment, home-like as it may be, instead of being home?
It's a very common thought process that everybody wishes to remain in their home, but there are those times and those patients that it just becomes so overwhelming that the family just can't handle it. And what I mean by that is they would love to keep their loved one at home, but due to the patient's symptom profile or issues that they're not accustomed to, they really feel overwhelmed and at times feel that they're not doing the best for their loved one. So they have the option of going to a hospice home where they can come in as the family, not worry about the care as far as, is my mother getting medicated on time? Is she getting the best possible medical oversight? And it gives them peace of mind when they go home at night that their loved one is taken care of.
You know, I have many interactions with families, especially at this point of care, end of life care. And I definitely appreciate the idea that families are overwhelmed. And I tell them, we really need to figure out how to allow you to be the daughter or the son or the wife and not the caregiver, although some very much want to be the caregiver. But it's so important at this time to be able to be part of mom and dad or grandma or grandpa's lives and not be involved specifically in the care. So this type of setting affords people that.
That's exactly what this type of setting does.
So with regard to delivering care, though, you talked about being medicated. Tell me about the staff that you have in the facility.
You know, typically, well, specifically in our hospice environment, we have, first of all, it's 24/7. There is always a hospice-trained nurse and a hospice-trained aide on at all times so that you have peace of mind that somebody's there all the time. In addition to that, we have a full complement of everything that goes along with the total care, such as we have, physician oversight. We have, social worker who works with needs of the families that crop up during this process. We also have, a chaplain who, attends to their spiritual needs and things that people don't even think about. For instance, we have an expressive therapist that work with children who are going through this as well, whether it's their grandparent, their parent, or whatever. And along with that, we have probably one of the most robust volunteer programs for a hospice facility where we have 27 people who are on staff that volunteer their time
Wow.
that do all the non-clinical things, such as the laundry, cooking, sitting with the patient, providing
You cook all the meals there?
all the meals, unlike an institution,
Wow.
are cooked to order. Of course, bearing on what the patient can tolerate, it's basically what they want. We shop multiple times a week, and if it's something that they want that we don't have, we get it.
Wow.
So yes, it's prepared to order. There's no set schedules. If somebody, and we have had situations who wants a bowl of chocolate ice cream at 3 o'clock in the morning, and that's what they would normally do at home, they would be afforded that there.
You do it. So it truly is, in the hospice house, it truly is multidisciplinary or interdisciplinary care. You have nursing, providers, social workers, everything to help the patient and the family kind of cope and move through appropriately
Yes,
in the setting.
Yes, and actually, in addition to that, we have music therapy. We have pet therapy, which is very, very comforting to the patients, where people come in every Saturday and they visit room to room. We also offer, all the additional therapies that families can bring in if they'd like, such as massage therapy or Reiki. I always mispronounce this, Reiki or Reiki. So there isn't really anything that we can't do to make that patient more comfortable or their end-of-life experience at the highest possible level of care.
So lead me through the process. So an individual has a end-of-life issue, whether it be cancer or heart disease or lung disease or some other neurologic disease, et cetera. They've gone through the process by which providers say you are a hospice candidate, and now there's a thing called the hospice house. So how does one get accepted to the house? What are the arrangements? What are the protocols that you deal with every day as someone new comes in?
Basically, patients come to us from many facets. We receive patients who, as we mentioned up front, were patients at home who are currently on hospice. Those situations, are fairly common, where families do like to keep their loved ones home as long as possible, and at a certain point, we may get a call from the family, and they will express their wishes that they can no longer provide what they feel the best care, so they'll seek us out. We also very frequently do take direct admissions directly from hospitals. There are those cases that do end up in the hospital, and during their hospital stay, their condition or their course of action has changed from acute to more comfort focused, and that's where a facility like ours will benefit them. And then there's also, I've had patients called directly on their own behalf, where they have actually been very active in their care, and also want to be very active in their decline. So there's no one area we can get a call from. We even have patients that come from out of state. We've had patients fly from California just to be back home in the area where they grew up with their family for their end-of-life care and comfort. So on any given day,
you're surprised.
Yeah, you never know.
Wow. Yeah. So this isn't a local thing. This isn't a regional thing. This is anyone who, and you have to be hospice, right?
You do have to be hospice.
Okay.
And you do have to have some level of clinical indications to us that you are end of life obviously, and that your care needs exceeds what you can get in the traditional format, whether it be by a family member or whatever. You can't simply just check yourself into a hospice home. However, the process would be, if another patient is looking for this type of environment, or a hospital is looking to place a patient, we would obviously at that point need to take a look at the whole picture. What are the clinical indications that are going on? Where do we think they're at in their process? And what do we think their care needs will be? And when we look at the whole picture, then we make a decision, is this somebody that would benefit from this type of environment?
But what I'm understanding from you is that there's no one standardized approach to all of this. It's actually on a person by person basis that you are evaluating folks.
Every single patient, we are looking at probably 15, 20 different parameters to get a picture of what does this person need? What is going to make them comfortable? What do we anticipate their needs are going to be tomorrow, a week from now, or a month from now? And if we feel that they meet that profile of that type of patient that would benefit from this environment, then they would most assuredly be afforded a bed.
So how long do people stay at the hospice house?
It varies. I mean, there is no standard per se. However, on average, now we're looking at 7 to 14 days. But we've also had patients, a couple of patients last year that were actually with us for over a year. So, there are standards that have to be met, and as long as they are appropriate for that environment, there is no time clock that says, sorry, you have to leave.
And so people will hear you say that you've had folks at the Sawtelle Family Hospice House for a year, and they'll say, but wait a minute. Hospice is supposed to be 6 months or less of life. But the reality is that science isn't perfect, and oftentimes the care that places like the hospice house can give, while people aren't cured, because that's not the nature,
right,
the caring can be so significant that people might be able to thrive for a period of time and still satisfy hospice.
Absolutely. And there is a little bit of a phenomenon that happens when patients do come to our house, especially where they have been transferred from a hospital. A few days in this more tranquil environment, the patients become less anxious. They become more tranquil. And a lot of times the families will come to us and say, they look better.
Yeah.
They're actually, my mother's more alert. And it's not that she's cured or she's getting that much better. It's just that her body and her mind is much more relaxed because they're not getting bombarded with all the extraneous noises and the hustle and bustle of a acute clinical
of life. Yeah. So the elephant in the room question is, how do people pay for this? Is this covered by insurance? Is this an out-of-pocket expense? When you think hospice, you think Medicare and the Medicare benefit, but is this different?
A hospice residential inpatient it's a 50-50 answer to your question. Medicare and most, if not all, insurances will actually pay for the clinical aspect of your care. And let's isolate Medicare. They'll pay 100% of your clinical care in the facility, which will include obviously the clinical oversight and the medications that are associated with the care for hospice and anything they would possibly need for their care. What most insurances do not cover is what we call the room and board. And that's typical. Room and board is that portion of the cost for the overhead of the facility and all the costs that go along with that. And that's typical in any sort of institution, whether it's a nursing home or a hospice house.
For routine hospice
For
benefit.
routine
Yeah.
hospice, yes.
Mm-hmm.
And our room and board is one of the most cost-effective, certainly in the area, and has been ranked, very cost-effective nationally as well, where a patient out of pocket is $250 a day, which is a lot of money in the grand scheme of things, but for the level of care that one receives, that is certainly a cost-effective option than keeping your loved one at home and paying around-the-clock help, which could be very, very costly.
Sure.
And it's certainly more conducive, as opposed to a skilled nursing facility, which could be a lot more money.
And there's also other unique issues that come up, things that you talk about all the day, every day, that may mitigate finances. But the issue is not so much the finances. The issue is the care that you all provide at the end of life, which just cannot occur anywhere else. So, thinking about someone's father being there, can you have visitors at the hospice house? Are there restrictions on visitors or time restrictions and things like that?
We try to accommodate as much normalcy as possible. So, do we have rules? Sure, we have to for various things. However, when it comes to the families, immediate family can come and go as they please. They pretty much have carte blanche to be with them as long as they want. Non-immediate family, we do have your typical visiting hours that you would expect in any institution. But when it comes to the immediate family, they can be there around the clock as well. We do allow one family member to stay with their loved one overnight if they wish. Although we try to alleviate that, because the point is you can go home and get your rest and be assured that somebody is with your mother or your father.
Yeah, that's nice. So, do people go home from the hospice house?
The answer is yes. It's not common. We on average see about 230 residents a year, and maybe out of that, 4 to about 6 patients a year rise to the level where they no longer meet that threshold for hospice, and under those circumstances would have to leave. That's a good thing. That the patient has been well enough that they're able to spend more quality time either back home with services or maybe go to an assisted living or something like that.
What are the most common illnesses that what are the most common illnesses you see at the hospice house?
It's a broad spectrum of clinical diagnoses, but prevalent and we do talk about this amongst the clinical staff. We have seen a very strong uptick in the cancer cases, particularly pancreatic. But it's not just limited to cancer. I mean, we see everything, respiratory, neurological, just about anything.
So I would imagine that the difference between someone at end of life with cancer versus someone at end of life with dementia is a very different process. Is there training that you all do? Is it just love and kindness that is universal? How does the staff able to differentiate the type of care needs that folks need?
Hospice staff is a very unique breed of healthcare providers. Usually, people who are in hospice have found their niche, and they are very good at what they do. Their skills are unbelievable. Their compassion is unmatched. They not only treat the person physically, but they treat the person emotionally. And as I mentioned earlier, of course our efforts are for the patient, but a big part of the patient are their families. So we spend a lot of time with the families as well, because we forget they're going through this as well. And they're going through the stresses and the strains. So the staff is very unique, and their training, you know, we're constantly learning, we're constantly adjusting, we're constantly, you know, looking at things that we could do better, but it's really an amazing staff.
And your staff meets regularly to discuss all the different patients that you may have at any time?
The care team meets, currently we meet once a week, and there's physician representation, advanced practitioner representation, and all the ancillary people I mentioned, the social worker, the chaplain.
Is there a wait list, or if there's someone who is of need for the hospice house, can they typically get in within a timely manner?
In a timely manner. Unfortunately, there's not a lot of hospice facilities in this general area. We typically do have a waiting list, and I cringe to use the word waiting list because it's not a numerical list. It's not a 10-page list. We try to accommodate patients in the most timely, efficient manner for obvious reasons. And average wait times could be literally hours to a day or so.
Wow.
We're not talking weeks, we're talking hours.
So you're able to satisfy the needs that folks have in our community and outside of our community as well. And how does one reach, or how does one get in touch with you?
They can certainly call the facility, and you know, I would be the one to address any inquiries as far as somebody having a particular need. We do like people or families to come in and have a discussion and see the facility. That usually answers all their questions once they see the facility. If not, you know, they can certainly email us or call us.
David, thank you very much for spending the time and talking about your extremely valuable program. David Agahigian is an example of someone in our community who advocates for individuals at end of life, and is the director of the Sawtelle Family Hospice House. David, thank you.
Thank you.